Surviving surgery might depend on more than just your health and your luck. New research has found that as the working week goes on, your risk of death goes up. The study looked at more than 4 million planned procedures over 3 years. Those which happened on Mondays had the lowest risk of death. It was 21% higher by Thursday. And for those who had an op on a Friday, the risk of death increased by 44%.
We suspect the reason behind this is that the most critical period following surgery is the first 48 hours. And as this 48 hours overlaps with services at the weekend, which we know are reduced, that might impact upon their outcome.
Now, we've long known about this so-called weekend effect in A&E departments. But now it's clear the same pattern applies to planned operations, which might have been scheduled months in advance.
We must get something done about this, and we must put pressure increasingly on all those that are in a position to actually bring some decision about to improve the situation, and quickly.
Well, that puts the pressure on the NHS's top doctor, and Sir Bruce Keogh says the problem is financial. There's more risk because there's less money.
Our health service is in the triple grip, I think, of increasing demand, escalating costs of healthcare, and a difficult financial environment. And we've got to find our way through that.
For frontline doctors, however bad the financial health of the NHS might be, the service needs to be the same 7 days a week.
I think a longer working week is likely to be better for patients. We haven't staff to deal with people who are recovering from maybe routine surgery, as discussed in this report today.
Despite today's figures, your chance of surviving an operation on a Friday is still very good indeed, over 99%. But in an organisation as big as the NHS, 1 percentage point can mean a lot of lives. Dominic Reynolds, 5 News.